On the day of your surgery, you're going to arrive at the surgery center, and you'll arrive early. They usually ask our patients to show up an hour to an hour and a half before their scheduled surgery start times. So what that means is there is a little bit of wait, and it's scheduled. It's anticipated that there will be some waiting, and that is simply so that all the process of getting you ready for surgery can take place. You're going to check in, and then they'll get you moved to the pre-op area. When you're in the pre-op area, you'll meet with a nurse. They're going to start an IV, and they're going to review your medical history. They're also going to ask some questions just to make sure that surgery is going to be safe for that day. After that time, you're going to meet with your surgeon, and your surgeon is going to be drawing some markings and some pictures. I always tell my patients they'll have you tucked in and cozy and warm, and I'm going to make you stand up and freeze for a couple minutes while we draw some pictures, especially if we're doing procedures on the body somewhere. After those marks are made, you'll go back to the operating room. In the operating room, you're going to fall asleep, and when you wake up, you'll be in the recovery room. Depending on the procedure, the time spent in the recovery room can vary between typically 1 to maybe as long as 3 hours. The dressings will vary depending on procedure, and you'll get all of your instructions. Before you leave that surgery center, you're going to have written instructions and descriptions from the nurses to you and the person taking care of you that day of what needs to be done and what needs to be taken care of. And you'll have all of our contact information. So if there are any questions or concerns, you'll be able to contact us 24 hours a day so that we can make sure that you're comfortable and you know what you're supposed to be doing.